Why did this happen again? You said the scan was clear. You said there was nothing there.
It didn't show what we were looking for. It looked safe, but it wasn't. Sometimes, after several hours, the bleeding can fade, almost disappear.
So you missed it. And now my father is fighting for his life?
This attack, silly, it could have been prevented? Honestly, it is a gray area. It might have been prevented. Medicine isn't always absolute. But what I could have done, recommending lumbar puncture. But it might have been. We will not stop fighting for him.
Welcome to the debate. Today we're tackling a really critical medical legal challenge. It's something every doctor might face. What happens when you have to disclose a non-intentional missed finding or an error that unfortunately resulted in patient harm? The big question here is, does being transparent about that kind of unintended failure actually serve the greater good? You know, patient safety, physician well-being? Or does it just open the door to, frankly, disproportionate personal, legal, and professional fallout for the doctor involved? I'm going to argue that the benefits of early, honest disclosure, especially within supportive systems like communication and resolution programs or CRPs, they really do outweigh the risks.
Mm-hmm. And I'm going to approach this a bit differently. While I absolutely agree the ethical goal of openness is, well, laudable, we have to be realistic. The current legal landscape puts a huge amount of personal risk, sometimes career-ending risk, squarely on the individual physician. We really need to look closely at the practical limits here. I mean, most state apology laws, they're only partial. They might cover you saying, "I'm sorry this happened," a sympathetic phrase. But they offer basically zero protection if you actually admit personal responsibility for the error. And that gap, that distinction, it leaves the physician dangerously exposed. It creates this undeniable pressure to just deny the error, even if it was completely unintentional.
Okay, I understand that skepticism about the current laws. I really do. But we need to focus on the tools, the mechanisms that actually mitigate that exposure. Look, early, honest communication about, say, a misdiagnosis or delayed care, it's proven to be effective. It helps rebuild that crucial trust, and it demonstrably reduces the long-term psychological distress for patients and their families. And, the financial side actually backs this up too. Big institutions like the University of Michigan, Stanford, they've successfully put these CRPs into practice. And importantly, they report zero negative financial impact on their overall risk portfolio. Why? Because the cost of settlements is balanced out by drastically lower legal defense fees and avoiding these long, drawn-out court battles. Plus, this approach, it can offer some real emotional closure for the physician, letting them avoid, years of depositions and harassment.
That's a strong case for the institution, I'll grant you that. But have you really weighed the personal cost when that system fails the doctor? Because once you have significant, real financial harm to the patient, just saying sorry, even if you offer compensation through a CRP, often isn't enough to stop a lawsuit. The hard truth is, in high-stakes situations, lawyers on both sides, plaintiff and defense, they often just dislike or ignore these apology laws because they're so, poorly constructed and variable. As soon as litigation starts, the whole adversarial process just steamrolls the ethical intentions behind the CRPs. My main worry is still the personal penalty, especially within the hospital system itself. We hear about these situations where credentialing committees basically have this unwritten, devastating 3 strikes rule for settling cases. That kind of threat, losing your ability to practice after 3 settlements, regardless of context, it's a huge direct disincentive for any doctor to engage in early disclosure, no matter how well-intentioned the CRP is supposed to be.
Right. The credentialing threat is serious, absolutely. And it definitely points to a need for a much deeper cultural shift within medicine. But I'm not convinced that fear justifies sticking with the old deny and defend culture. CRPs, when they're done right, are fundamentally about improving patient safety and quality. And think about this. If a settlement happens early, before formal litigation kicks off, that event might not even need to be reported to the National Practitioner Databank. Avoiding that entry is huge for a physician.
The real starting point has to be changing the culture, moving away from shame and blame towards what we call a just culture. That, plus diligent actions like meticulous documentation, clearly outlining the clinical reasoning, that builds a record that looks, well, diligent to a jury. It can minimize liability even when these non-intentional errors inevitably happen sometimes. But you're asking the individual doctor to take a massive leap of faith there. The system as it stands often sees any admission of fault, whether it's legally protected or not, as just signaling a stronger intent to sue from the plaintiff's side. And that institutional threat, that three strikes idea, it's not just theoretical. It directly pits the doctor's entire career against the ethical call for transparency. You're essentially asking doctors to risk their livelihood for a systemic ideal that the system itself often undermines through these exact credentialing pressures and, frankly, pretty weak legal shields. I acknowledge those systemic hurdles exist, they certainly do. But the data we have suggests the trend towards transparency, managed through well-designed programs, offers the best route for long-term quality improvement, for patient well-being, and yes, ultimately for physician integrity too. We have to keep pushing to support and refine these CRPs until they are truly universal and fully protective.
I'm sorry, I don't think that individual risk is truly manageable across the board yet. Until we see real systemic change that addresses how variable and often inadequate these apology laws are, making them truly comprehensive, and gets rid of those institutional disincentives that doctors face, the risk of severe personal penalty for admitting an unintentional error, it just remains too high for many physicians to realistically take on.
It's clear the material highlights this really profound, everyday tension, doesn't it? Between the ethical desire for disclosure and the very high stakes of our current legal realities.
Absolutely. It confirms this is an area needing ongoing, very thoughtful reform, so we can genuinely support doctors in making these incredibly difficult admissions without them fearing for their entire careers. There's still a lot to figure out.
I'm going the distance. You can bet on that.